Okay, so here we have the Astral 150. It's going to be our backup ventilator to the servo should we run out of the servo during this issue with COVID-19. So I have it configured right now with our infant circuit, just like we would on the servo. We also can use the adult circuit, same practices we're going to do on the servo. So I want to talk about a little bit the differences you're going to have with using this versus the servo on your patients. First of all, pretty much the only mode that we're going to be able to use that mimics any servo use would be SIMV, pressure control, pressure support, which I'm sure everybody is familiar with that mode itself. The Astral 150 does have a couple other modes, but they're not exactly like the modes we use with the servo. They resemble some volume support, but they're not exactly the same. So the only kind of apples and apples with using this vent in replace the servo would be just to use SIMV, pressure control, pressure support. You still are going to have two waveform graphics here on the Astral on your patients. You still have a pressure waveform and a flow waveform. You'll lose the volume waveform that you have on the servo I, but we still are able to have some pretty good graphics on our patients to check our eye time needs and whatnot. As far as the settings go, the settings you order on the servo are pretty much the same settings you're going to order with this. Nothing's really going to change. Pretty much how we set the servo, we're going to be able to set pretty close with this vent as well. You'll have your pressure control setting, your PEEP, your rate, your pressure support order. We'll have a rise time adjustment. We'll have an eye time adjustment, just like on the servo. We'll have a percent cycle adjustment for your pressure support breaths, just like on the servo. And we'll have a trigger adjustment like on the servo. Now, the downside, what I have noticed on this is when using the dual limb circuits like we're going to use here, the triggering capabilities is not quite as good as the servo. So you might have to see if the patient's able to really trigger appropriately on his spontaneous breaths, and that could possibly be an issue with the smaller patients. But that is going to be a downside with this. Everything else will function pretty much like we have with the servo. We're going to use the same heaters, the same circuits. We'll run our nebulizer treatments. Every treatment we run on the servo, we're going to be able to run here. There'll be no more dead space than you have on the servo. The circuit connection to the inline suction catheter with the end tidal will function in the same manner. And we will still use the same size circuits as we do with the servo. The graphics won't be able to be seen from outside the room as we walk by, like we like to be able to see, constantly with the servo in our ICUs. But there's really no way around that. Maybe we can position this in a manner that you can see the waveforms from the doorway. If you have any questions, you can always call me on my extension 86753, and I will be doing follow-up and some follow-up education with the RTs to make sure everybody's aware of how this is configured. They pretty much use this on home patients now already, but I just want to double check, make sure everybody's up on speed on doing the dual limb circuit, because typically home patients are on the single limb. So like I said, if you have any questions, just give me a call. 86753 is my extension.